Hello friends, welcome to MedicoExplorer. So today we are going to discuss the cholinergic drugs. So in this video we are going to cover the common effect of the cholinergic drugs, the nervous system that is involved in the cholinergic drugs, the types of the cholinergic drug, that is the direct and direct acting and the indirect acting. And in on the basis of the synthesis there is synthetic esters and the plant product is the alkylate. So let's start the video. So as we all know that the cholinergic system is the part of the parasympathetic nervous system, and parasympathetic nervous system generally plays important role in the secretion of the acetylcholine. So therefore it is also known as another term, that is the parasympathomimetic. This word is very important, parasympathomimetic. So the common effect of the cholinergic drugs that can be remembered as the dumbbells, DUMBBELSS. So basically the key concept is that the increase in all body secretion. तो cholinergic ड्रग्स का इफेक्ट क्या होगा बॉडी में? तो बॉडी का जो सिक्रेशन है उसको इंक्रीज करेगा, जैसे कि D for diarrhea, U for urination, M for meiosis. It's also known as the pinpoint. This is pinpoint eye. And B for bradycardia, increase in heart rate. Sorry, bradycardia, the decrease in heart rate, parasympathetic, no? And B for further the bronchospasm, L for lacrimation, and 2S stand for the sweating and salivation. So now coming to the types of the cholinergic drugs, there is the directly acting and the indirectly acting. तो इसको डायरेक्टली में मतलब डायरेक्टली एक्टिंग से क्या समझ में आता है? तो इट इंडिकेट्स दैट रिसेप्टर एगोनिस्ट. तो रिसेप्टर एगोनिस्ट का मतलब क्या है? सपोज इज द pre-synaptic membrane is the post-synaptic membrane is the synapse. Suppose there is a exercises of the neurotransmitter that is let be acetylcholine. So it can be bind to the N receptor and the M receptor on the postsynaptic membrane. But in case of indirectly acting cholinergic drugs, what is happening here? That the anticholinesterase increase the endogenous acetylcholine. So suppose uh, there is an enzyme known as acetylcholine esterase enzyme. That can be two type, acetylcholine esterase enzyme, or another is butyrylcholine esterase enzyme. So anti-acetylcholine esterase, one type of acetylcholine drug that will destroy the acetylcholine esterase, and indirectly it will help to bind to the N and M receptor and further causing the action. So it is increasing the endogenous acetylcholine neurotransmitter. So now coming to the synthetic part, the esters. The synthetic one is the esters. Examples are acetylcholine, methanicol, carbachol, and the methacholine. So here we'll be looking on the basic superficially the idea. It is the shortest acting drug because it is rapidly degraded by the BACC, that is known for the butyl acetylcholinesterase, butyl acetylcholinesterase, and bethanicol. What is bethanicol? It is actually the M3 agonist. M3 agonist, and it is used for the urinary retention. In some patient, post-operative patient, there is loss of urination, therefore it is used to in the urine. So in case of carbachol, carbachol is used for the mucosis. There is the eye drop is in surgical procedure. The eye drop is applied so that there is a contraction of the pupils and no further complication in further cases. So now coming this the most important, that is the methacholine. So what is methacholine? Uh, is for that is the M2 agonist. तो इसका काम क्या है? इसका काम है मेनली डायग्नोस्टिक टेस्ट में एक इम्पोर्टेंट टेस्ट का नाम है जो कि मेथाकोलिन चैलेंज टेस्ट। इस टेस्ट में हम थोड़ा 2-3 मिनट बाद देखते हैं। तो नेक्स्ट इज एल्कलॉइड, दैट इज द प्लांट प्रोडक्ट। इसमें क्या क्या है? पाइलोकेरिन है, एरिकोलिन है, निकोटिन है और मस्करिन है। तो पाइलोकेरिन किसमें? पाइलोक्रस से एक्सट्रैक्ट किया जाता है, एरिकोलिन बेटेल नट से एक्सट्रैक्ट किया जाता है, निकोटिन दैट इज एक्सट्रैक्ट फ्रॉम द टोबैको प्लांट। ये ऑल्सो मतलब इट इज ऑल्सो यूज टू ट्रीट द पेशेंट ऑफ द smoking addicted patient. And muscarine is obtained from the poisonous mushroom. Although this is not an plant, but it is involved here because it is a nasal product. It's a nasal product. So now coming, what is methaqualone used for? That is the M2 agonist diagnostic test for the asthma. So methaqualone challenge this is nothing but it is the inhalation of the methaqualone. It is also known as the provocative test to diagnose asthma. तो इसमें क्या किया जाता है? देखिए, सपोज M3 रिसेप्टर होता है। M3 रिसेप्टर होता है जो रेस्पिरेटरी सिस्टम ब्रोंकस में मतलब प्रीडोमिनेंट होता है। बट इन केस ऑफ द inflammation of the alveoli or the lungs, there is also involvement of the M2 receptor, and this methaqualone is targeting the M2 receptor and increase the contraction, and it is it is going to further complicate the condition. Therefore it is asked for the patient that to inhale the methaqualone to test whether the patient is suffering from the asthma or not. Therefore it is a provocative test to diagnose, and it is challenging because it is given to the patient in a way of challenging the condition. So basically in this lecture this much only. So in next lecture we will be discussing on the this pilocarine drug. This is very important. So thank you for watching the video. Study well. Thank you.